Hello, this is Pediatrics tailored to the high-yield emergency medicine shelf review. And just to preface this video, there are going to be a lot of rashes or pediatric traumas and things that show up in other videos. The remainder of this content of the video cannot be found in any of the other videos, so it's in its own special place. So with that being said, jaundice in the first 24 hours of life is pathologic, and these patients are more likely to develop severe jaundice, which could progress to kernicterus. Malrotation with volvulus that presents 3 to 7 days with bilious vomiting. The small bowel will twist around the superior mesenteric artery, resulting in vascular compromise, leading to ischemia and necrosis of the bowel. You diagnose with an upper GI series, and the treatment is surgery. For pyloric stenosis, it presents as non-bilious projectile vomiting. There may be an olive-shaped palpable mass. The ultrasound will be beneficial in terms of if you're unable to feel the olive-shaped mass, but if you still have a high suspicion for pyloric stenosis. And then pyloric stenosis produces a hypokalemic, hypochloremic metabolic alkalosis, and the treatment is surgery. Intussusception occurs 3 to 36 months of age with current jelly stool. Often the child will draw their legs up and the abdomen with pain-free periods in between episodes. The contrast enema is both diagnostic and therapeutic. Duodenal atresia presents as a congenital obstruction of the duodenum associated with Down syndrome and in pregnancies that are complicated by polyhydramnios. The double bubble sign on X-ray will show bubbles in the stomach that occur with a dilated proximal duodenum, which confirms the diagnosis. The treatment is surgery. Hirschsprung's disease, also known as congenital aganglionic megacolon. It's basically where there's an absence of ganglionic cells in the distal colon, so most commonly in the rectosigmoid area. The symptoms include stool in the rectal vault, abdominal distension, and bilious emesis. In newborns, it will present as failure to pass meconium, and in children, the child will present with chronic constipation. You diagnose via rectal biopsy or rectal manometry. It can lead to toxic megacolon. A necrotizing enterocolitis is common in premature infants who have difficulty with feeding, emesis, abdominal distension, and guaiac-positive stool. Pneumonitis intestinalis is where there's going to be air in the bowel, and it will present on X-ray. The treatment is supportive antibiotics, and these patients may need surgery. And last but not least, Meckel's diverticulum is a classic presentation that is painless rectal bleeding in an otherwise healthy infant. The rule of 2 should be helpful. It presents in 2% of the population. Only 2% ever develop symptoms. Located within 2 feet of the proximal to ileocecal valve and 2 centimeters long and 2 centimeters wide. And half of these patients develop symptoms by the age of 2. The most common cause of cardiac arrest in children is actually due to respiratory arrest. Bradycardia in a newborn is most commonly an indicator of hypoxemia. And remember that chest compression should be started in infants with heart rates less than 60. Tetralogy of Fallot consists of 4 key points. There's going to be presence of a VSD, right ventricular hypertrophy, right ventricular outflow obstruction, and the presence of an overriding aorta, diagnosed via echocardiogram. And TET spells are cyanotic spells or episodes that are precipitated by a decrease in systemic vascular resistance, leading to increased shunting. The treatment is high flow oxygen. Couple of pulmonology disorders to discuss here. Foreign body aspiration is when the patient or the pediatric patient is going to come in coughing, wheezing that does not respond to nebulizers, or in a patient who has a chronic cough or recurrent pneumonia. Normal plain films are not enough to diagnose. A bronchoscopy can provide definitive diagnosis. Neonatal pneumonia most commonly is caused by group B strep. The risk factors include preterm prolonged rupture of membranes. Bronchiolitis is most commonly caused by RSV, a viral prodrome followed by wheezing, rales, and retractions in children less than 2. If there's nasal flaring present, retractions, grunting, tachypnea, or hypoxia, then the patient will need to be hospitalized, and a trial of bronchodilators for treatment will be added on. Croup is the most commonly virus seen in 6 to 36 months of age. It's associated with parainfluenza virus. Symptoms include nasal congestion, hoarseness, a bark and cough, fever, and stridor. You'll see a steeple sign on X-ray, and the treatment is beta agonist and dexamethasone. Epiglottitis signs and symptoms include severe upper airway obstruction presenting as stridor, retractions, and hoarseness. Presentation: the patient will be in a tripod position, difficulty clearing secretions. The thumbprint sign will be present on lateral neck plain films. The treatment is intubation in the OR at first, and then you'll go ahead and give antibiotics. Antibiotics you can use are ceftriaxone and cefotaxime. Cystic fibrosis is the number one cause of pediatric hemoptysis, high risk of developing spontaneous pneumothorax, and patients develop recurrent bacterial pneumonias. Brachial cleft cysts appear in otherwise healthy children who develop a neck mass around the age of 5 or so. The management is removal by ENT specialists. Kawasaki's disease is characterized by fever greater than 5 days in duration with 4 of the 5 symptoms: conjunctivitis, rash, adenopathy, strawberry tongue, and hands and feet edema and erythema. The treatment is IVIG and high-dose aspirin, and if it's left untreated, can lead to coronary artery aneurysm. And then the rest of the rashes described like rubiola, and rubella, those are going to be in the dermatology video, and I'll give a link below. And then the last little bit here is just going to be cephalohematoma and succedaneum. They're more common with forceps and vacuum deliveries. They're often resolving spontaneously, and cephalhematomas cause swelling that do not cross suture lines, whereas the succedaneum causes swelling that extends across suture lines. And then infantile spasms, those are epileptic spasms that start between 3 and 8 months of age, presenting with jerking movements characterized by the body suddenly flexing or suddenly extending. You diagnose with EEG, which will show hips arrhythmia. The treatment is ACTH, and this is a very poor prognosis with a very high mortality rate, unfortunately. Then febrile seizures can develop after vaccinations, like 1 to 2 weeks after MMR, for example. They consist of convulsions that occur in a child between 6 months and 6 years of age. There is a family history that will present as a risk factor for these patients. Complex febrile seizures are greater than 15 minutes in duration, and children may have temporary weakness. Risk factors for recurrent febrile seizures include younger in age, lower temperature at the time of seizure episodes, and these patients have an increased risk of developing epilepsy compared to the general population. And then pediatric trauma and ingestions are covered in my trauma and GI video, which are linked in the description below. And thank you guys so much for watching.